Welcome to this module on smile assessment and lip movement. In the field of aesthetic medicine, particularly when addressing gummy smile correction, accurate assessment serves as the vital bridge between your anatomical knowledge and the delivery of safe clinical treatment. As a provider, you are not simply observing a patient's appearance. You are evaluating a dynamic neuromuscular process. This evaluation is the single most important factor in determining whether a treatment is appropriate, exactly where that treatment should be targeted, and perhaps most importantly, how conservative your approach must be. In the context of U.S. aesthetic practice, this step is critical. It is the cornerstone of patient selection and the first line of defense in complication prevention. Furthermore, it forms the basis of defensible documentation. A thorough assessment ensures that every treatment decision you make is rooted in observed function rather than assumptions. By the end of this section, you will understand how to transition from static observation to a comprehensive functional analysis. A fundamental rule of aesthetic assessment is that a gummy smile cannot be evaluated at rest alone. To understand the why behind the what, the clinician must assess the patient in motion. This follows injection best practice frameworks, such as the art of injection, which emphasize the active engagement of facial muscles. During your assessment, you must guide the patient through a specific series of movements. First, ask them to smile naturally. Next, ask them to smile maximally, achieving full muscle contraction. Finally, have them repeat these movements multiple times. This repetition is key to observing the true nature of their muscle recruitment. Through this process, you are looking for 4 specific markers. The onset of gingival display. Does it happen early or late in the smile? The extent of the lip elevation. The muscle dominance patterns, specifically central versus lateral pull. And finally, the symmetry between the left and right sides. There is a critical distinction to be made here. If the gingival display only occurs during the act of smiling, it is more likely a muscular issue. However, if the gingiva is visible even at rest, this suggests a structural or skeletal involvement. This differentiation is the go/no-go point for neuromodulator treatment. Not all gummy smiles behave the same way. Identifying the specific pattern of lip movement is what allows you to move from a one-size-fits-all approach to a refined professional treatment plan. In clinical practice, we categorize these into 3 broad patterns. First is the central elevation pattern. In this case, the upper lip elevates predominantly in the midline, exposing the gingiva above the central incisors. This is typically driven by the dominance of the levator labii superioris obliquenasi, or LLSAN muscle. Because it is localized, this pattern is often the most responsive to targeted neuromodulator treatment. Second is the generalized elevation pattern. Here, the entire upper lip elevates uniformly across the smile. This involves a complex interplay of multiple elevator muscles. Because the activity is widespread, it requires a much more cautious and distributed treatment approach to avoid a heavy or frozen upper lip. Finally, we have the asymmetric elevation pattern, where one side of the lip elevates significantly more than the other. This reflects uneven muscle activity and presents a higher risk for post-treatment asymmetry. Recognizing these patterns ensures your care is customized rather than standardized. This level of individualized care is not just a clinical preference. It aligns with CE and ANCC expectations for professional healthcare delivery. Beyond recognizing the shape of the smile, we must evaluate the intensity of the contraction. Muscle strength varies significantly between individuals, which reinforces why we cannot use the same dose for every patient. We categorize muscle activity into 3 levels. Mild elevation may require minimal or even no intervention. Moderate elevation identifies your typical candidates for conservative treatment. However, strong or hyperdynamic elevation may require higher dosing. Even with strong muscles, the art of injection emphasizes a conservative start. Always begin with a conservative initial dose and perform a thorough reassessment before considering any additional treatment. This prevents the functional impairment of the lip. Why is this assessment so critical? Because it directly impacts your injection site selection, your dose planning, and your overall risk of complications. Consider the risks. If you miss a baseline asymmetry during your assessment, It will likely lead to uneven results post-treatment, which the patient may perceive as an injector error. If you overestimate the muscle contribution, you risk overtreating the area, leading to functional impairment of the mouth. From a defensibility standpoint, your documentation must clearly demonstrate that your treatment decisions were based on observed dynamic function, and not simply because the patient requested a procedure. Your assessment findings are the direct guide for how you will use neuromodulators. Whether you are using Botox Cosmetic, Xeomin, or Nebota, your assessment dictates the strategy. For a central elevation pattern, your focus will be on the LLSAN region. For a generalized pattern, you will take a cautious, broader approach to targeting. For an asymmetric pattern, you will apply differential dosing, adjusting the units per side based on the muscle strength you observed. Regardless of the pattern, your dose must remain conservative and individualized. The goal of assessment is to ensure the neuromodulator is used to modulate specific muscle activity, not to suppress overall lip function entirely. Sometimes your smile assessment will reveal that the gummy appearance isn't just about muscle. It may reveal structural contributors, such as poor lip support or a volume deficiency. In these cases, dermal fillers, such as those in the Dermaphy portfolio, may be considered as adjuncts, but not as the primary treatment for the muscle hyperactivity itself. For instance, a patient with a mild gummy smile and a very thin upper lip may benefit most from a combined approach. However, be cautious. Applying excessive filler without addressing the underlying muscle activity can lead to unnatural projection or an imbalanced look. Your assessment determines if the path forward is neuromodulator only or a combination-based plan. During your evaluation, you may also identify skin laxity or general perioral aging. While devices like Scarlett RF for radiofrequency microneedling or Shoerink for HIFU are excellent for improving skin quality and tightening, they serve a specific role. It is important to remember that these devices do not affect muscle contraction or the dynamics of lip elevation. Therefore, their role remains strictly adjunctive. They are used to enhance the canvas of the skin, guided by your assessment findings, rather than as a primary treatment for the gummy smile itself. The smile assessment is your primary opportunity to identify red flags before the needle ever touches the skin. Key risks include missing a baseline asymmetry. Another risk is treating patients who actually have minimal dynamic elevation. In these cases, intervention may be unnecessary and counterproductive. Furthermore, you must always screen for functional concerns such as speech issues or poor lip competence. Botulinum toxin safety data reminds us that effects can extend beyond the immediate injection site. This risk is significantly increased when the initial assessment is inadequate and the targeting is imprecise. To ensure clinical excellence and legal defensibility, your documentation must be thorough and reflect the dynamic nature of your evaluation. Your notes should include the degree of gingival display during a smile, the presence or absence of display at rest, the specific pattern observed, and the muscle strength. Including these details supports your clinical decision-making and ensures continuity of care if the patient sees another provider in the future. Before you proceed to selecting your injection points, you must pass through this final safety gate. Ask yourself, is the dynamic assessment complete? Have I identified the pattern? Is the symmetry documented? Have I gauged the muscle strength? And finally, are the patient's expectations aligned with a realistic outcome? If any of these steps are incomplete, you must pause the treatment plan and perform a reassessment. This commitment to the assessment process is what defines a safe, professional, and successful aesthetic practice.